Good afternoon, and thank you for joining us today. We're so excited to be sharing today's film with you. It so wonderfully showcases the important work that the Lori Tisch Illumination Fund has been doing and reflects the sort of ideas that permeate our own terrific nutrition program and the research and education that takes place there. In the film we're about to see, we'll follow street cart vendors who sell fruits and vegetables in food deserts. Places in New York City that have been called such because finding fresh and healthy food and affordable food is challenging. As you'll see, their stories reflect some of the major issues of our time. Of course, health, healthy eating, and obesity, but also immigration and employment. The film has been called fascinating, engaging, and inspiring, so we have a lot to look forward to. The Apple Pushers is indicative of a larger agenda that Lori Tisch, who is one of our closest friends and vice chair of our Board of Trustees, has been successfully championing through the Lori Tisch Illumination Fund for years. The fund works to improve access and opportunity for everybody here in New York City by supporting innovative approaches to the arts, education, and healthy nutrition. And of course, there are many synergies with our own nutrition program, with the work that Isabel Contento and Pam Cook and others are doing here at TC. Our nutrition program, it says one of the nation's first, but it is the nation's first. Our nutrition education program, the nation's first, works to provide education to future leaders in nutritional counseling, health promotion, and healthcare policy. And we're also working here at TC, like Lori is, to get knowledge about about healthy eating and food and the place of food in lifestyles out to the communities through our scholarship and through direct work in schools and communities. At the Teachers College Community School and a set of partnership schools that work together, we're committed to bringing healthier lives to students and communities through a full set, comprehensive set of services to complement the wonderful education that's going on there. So, an exciting event this afternoon, and to help me in welcoming you to this event is Rick Lufglass from the Lori Tisch Illumination Fund. Rick is executive director of that fund, and he's long been involved in community engagement initiatives and has worked with a broad range of organizations, including the Annie E. Casey Foundation, the Department of Housing and Urban Development's Choice Neighborhoods, and the U.S. Department of Education's Promise Neighborhoods initiatives. Thank you. Rick?
Thank you, Susan. We are very honored to be here. We have enormous respect for the work of Teachers College across a number of disciplines, and we're big fans of the food nutrition program in particular, but think that there's such a wealth of knowledge resident within TC across various fields. And Lori, as a vice chair of the board, has really gotten in depth in terms of her own knowledge of the institution. And I've been at the fund for about a year, a little over a year, and so I've had the great opportunity to get to know people like Pam and Isabel and Suzanne and Susan and various others. I was asked to give a little bit of a context of how this film came about and how the fund's involvement in the New York City Green Carts Initiative came about. The foundation was started in 2008, and as Susan identified, the broad mandate was around access and opportunity, and that can be around any number of fields, whether it's health and nutrition or education or the arts, focused specifically on New York City, which is where Lori and her family are from, and really when she started the foundation, wanted it to be a foundation that was very much dedicated to New York City in communities in need. When she started the foundation, one of the first things that happened was Mayor Bloomberg called and said, "Have I got a project for you?" And what had just happened was the city council had just passed new legislation to enable a set of 1,000 street vending permits to be authorized in New York City specifically to sell fresh produce in, again, what are proverbially food deserts, but have number of other features. And the concept was, as you know, New York City taxi medallions are limited, and there's a black market. Similarly with street vending permits. They're capped. There's a black market. You can wait 10 or 15 years to get a permit. And so the city decided to create this special opportunity that both enabled people who were trying to become vendors to get licenses, and specifically to channel that sort of energy and employment towards high-need communities, those communities that have high rates of obesity, diabetes, heart disease, and other diet-related diseases. So Lori joined forces. They were looking for a private foundation to sort of be the partner with the city and to put in the kinds of resources to enable it to be more than just sort of a legislative policy change, but really to provide training to vendors in how to set up a business, how to finance a business, a whole host of workshops offered, and there's a team from a company here in New York called Carp Resources that does the sort of on-the-street assistance, getting to know the vendors and sort of problem solving. So it really is more of a comprehensive sort of business strategy and food strategy, not just a set of permits. Lori had a thought that this is such an interesting program that we should try documenting it. And she started talking to a filmmaker by the name of Mary Mazzio, who had recently done a film on an organization called the National Foundation for Teaching Entrepreneurship. And it looked, in that case, it was a business entrepreneurship competition for high school kids, and it followed the stories of several of the kids, their lives as they went through this process. And so when Lori met Mary and saw the film, sort of the light bulb went off and said, this is more than just street vending, but this is the lives of people on the street and the experiences that they bring to bear on the work that they do. And in many cases, I think estimated about 90% of street vendors in New York are first-generation immigrants, and it's always provided for centuries sort of a foothold into the New York economy. And so that became the lens to tell the story of New York City Green Carts through the stories of the vendors themselves, what it took to come here, some of the challenges in setting up the business, and really sort of the whole impetus behind the program. And as you'll see, it wasn't always a smooth road. Anyone involved in public policy issues knows that there is never a straight line to solve an issue, and you'll get a little sense of that here. So without further ado, we should roll it.
That was so helpful, and I loved getting the view into the world of the vendors. And I want to thank all of you for staying for what I promise will be a very brief panel. But I think we all saw that green carts are really a win for everyone, for the vendors, for the people that need the access to the healthy food, and for helping to decrease obesity in our country. I'd like to introduce the panel that we have, and I'm going to introduce each of them very briefly and then give them about a minute or two to speak. First, we have Dr. Isabel Contento, who is the Mary Schwartz Rose Professor of Nutrition and Education, where she's been at Teachers College for a while, and she's written a textbook about nutrition education. Then next we have Miss Emma Jackson, and she is a lifelong resident of Harlem and has been a very long time advocate for over 5 decades for good, healthy food in Harlem. And next we have Dr. Heather Greenlee, who is from the Mailman School of Public Health and works trying to decrease cancer through having people eat healthier, especially eating more fruits and vegetables. And finally, we have Erica Irvin, who is a student at the Mailman School of Public Health and the vice president of the Students for Food Policy and Obesity Prevention, and she also has worked for Health Corps for a number of years. So, Dr. Contento, would you like to speak?
Can you hear me? Is this on? Yes. Hi. The nutrition program here is very proud to be able to be part of this film showing, and I thought I would just take a couple of minutes to provide context. We're a nutrition education program, and nutrition education was originally thought of as something that you just provide a lot of information to people and people will change their eating habits. More recently, it's come to represent that nutrition education is about helping people change their behaviors with a focus on psychology. And more recently, we've become more aware that for behaviors to change, we need to have environmental supports. And so a social ecological model has become much more widespread. And that means you not only help people to make changes in their behaviors, but you also change the environment. Now, when you want to change the environment, where do you begin? I mean, this is a very large environment. And I think this film is an excellent example of how one person, one group, Lori Tisch, and her foundation thought of a way to help to change the environment. So it shows two things. One is, on the one hand, shows how even one person and one program can make a difference. And secondly, on the other hand, it shows that even when you're trying to change a very small corner of the environment, how difficult it is and how much effort there is. And so when we start saying we need to change the environment, I think this shows us both how wonderful that it can be, and also at the same time we can't underestimate the challenges that are going to be involved.
The film is interesting to me because I'm a lifelong resident of New York. I was born and raised here. As a kid, I remember going to the Park Avenue Market, and we had all the fruits and vegetables. We had a dynamic group of vendors who were European, Italian. And then I watched as my community began to change, structures, people leaving. We had no stores. Then we had the migration of the Koreans who, when they came, we had on like every other corner, maybe on each block, 2 greengrocers and fresh fish. Then things started to change again, and then we had nothing. We had no supermarkets in East Harlem. We had no access to food, not necessarily good food or fresh food, but we started to get an increase in the number of fast food entities. I live in a public housing development, and in my public housing development, we have 1,400 families, which roughly translates into approximately 5,000 persons. We have a small commercial strip on the avenue, and in that strip, we had a supermarket that had been closed for more than 3 years. We had another supermarket 2 blocks down, and it was on the verge of closing. And we worked very hard and tried to get the elected officials to keep that store open. Eventually, the store closed, and my neighbor and myself went into action. I have no board, I have no money, I have nothing but a computer and the ability to talk to people. And that's what we did. We virtually created a list, all the elected officials, and had everybody call and say, if this is going to affect you and the way you and your family eat, then call your elected officials. Well, I tell you, in East Harlem, we haven't had anything like that in years, and they were like, who in the world did this? And when they found out it was myself and one other neighbor, the store did close. But we did succeed in getting the store and the development open. We're now fighting with New York City Housing Authority to keep that store because of some displacement action that's there. But in the meantime, and I have to tell you this to Mike, because Mike, I haven't seen you. We have some people here who work with me and help me. Mike, the store that initially started this is now reopened, so you have to go and see it. I will. Yeah. We've had, in Harlem, since we started the advocacy to reopen that store, in Harlem alone, we got 3 new supermarkets, a Fine Fair on 145th, Pioneer on 129th and Lenox, as well as a store on 118th and 8th Avenue. In East Harlem, I'm proud to say that all of the stores that have been closed have now been reopened, and we've added one store that was completely torn down the building. The plan is to put a supermarket back there. So we have now Costco's as well as Targets, and we have a lot of access to good food, but we have our green carts as well. I would say that it has an impact on the eating habits of my community. It's sad, but we still have those problems, and we have to work much, much harder on educating. And I see that as my next step, because we do have access. And because it's there doesn't mean that we will use it or that it's going to be used, because people have misconceptions about food, what make people fat, what make people full. And so we have to still work at it. And that's where my next step will be, is to help educate and bring about people using those services that are there and making it work for them for a healthy life. Thank you.
Thank you, and that just shows how big the food access issue is and how we can work together to combine that with having people know what to do with the food. Now, Dr. Greenlee?
Sure. First of all, I just want to thank Dr. Contento and Pam for the opportunity to come speak with all of you today. This is a fantastic documentary, and this is my first chance of being able to view it. So I want to talk with you a little bit about, or to share with you, the project that Isabel, Pam, and I have been working on together, along with some students here in Teachers College, where I think we're really building upon this idea of food access. And what we're trying to do is now teach communities how to actually choose food and prepare food so that they and themselves and their family can all eat healthily. So I work at the School of Public Health up at the Medical Center. I'm also faculty in the School of Medicine in the Hematology Oncology Division. And what we're trying to do is teach breast cancer survivors how to eat healthily. We think that eating a healthy diet after a breast cancer diagnosis can extend a woman's life. There's some conflicting data on that, but we know that if women eat healthier in general, it prevents cardiovascular disease, it prevents metabolic diseases. But a lot of the women that we work with are from low SES backgrounds. They don't have a lot of resources at their disposal to eat healthily, and so we want to give them the skills that they need. So we have a program that's funded by the National Institutes of Health. It's called Cocinar para su Salud, which translates as Cook for Your Health. We've partnered with a local nonprofit organization called Cook for Your Life. Look them up, cookforyourlife.org. And what they've done is they go around the city and they do healthy cooking classes for cancer survivors. And when I found the woman, Ann Ogden, who founded the program, I said, your program is incredible, and we want to see whether or not this works. So we looped in some folks here from Teachers College to use their model of understanding behavior change, and we've developed a course that's over 9 weeks to teach specifically Latina breast cancer survivors basic nutrition education, teach them how to shop for healthy foods, including going to green markets, local grocery stores, using the green markets in their communities, and then teach them how to cook the foods in culturally relevant ways that are low fat and high in fruits and vegetables. And so we're really excited. Karina Aisinina is our study coordinator, and we've just finished recruitment for this study, where we'll have our study results in this fall. But so far, we think that this program has really had an impact on these women's lives. We know socially it has. What we don't know yet is whether or not we're able to affect any long-term changes. As I was telling Ms. Jackson, what we want to do is take this program that we've adapted for a Latina community and adapt it to other cultural communities within New York City, so that we can really have this broad-based approach to be able to establish healthy eating patterns in the city. So I think the food cart program is just one step in that direction as well. So thank you all for being here.
Thank you. And Erica?
Hi, so I'm Erica. I'm the Vice President of FPOP, Food Policy and Obesity Prevention, up at Mailman. Currently, we're only at Mailman, and we started about a year and a half ago because we realized that the courses at Mailman, well, we aren't really representing the issue of obesity. We have wonderful professors like Greenlee and Andrew Rendell and Claire Wang, who are doing incredible research on the issue, but we don't really have any direct focus at it. Compared to down here at Teachers College, where you have Isabel Contento. So we're very jealous up there. So we came together, a group of students, and we have started to provide panels. One we had was on perspectives of obesity, from genes to the built environment to behavior, which Contento actually talked at. We had panel a few weeks ago with Mark Bittman and Ed Clooney of the Congressional Hunger District talking about food stamps. And we do a bunch of cooking demo classes. And we're really trying to bring awareness to that community up there about obesity and the need, because it's in Washington Heights and it's a very strong need to bring that issue to public health. It seems obvious, but it's not as big as you would think it should be. And my background before I came to FPOP and Mailman was working for a nonprofit called Health Corps, which was founded by Dr. Oz. And Health Corps has put 53, up to this year, young adults in high schools across the nation to educate on nutrition, exercise, and mental health. So I spent 3 years in a high school in the South Bronx, in Mont Haven, which multiple pictures in the video were actually of. And I've gone into workshops for different classes. I'll go into a science class and we'll talk about how our body takes down nutrition and breaks it apart, and then how it builds back healthy muscles. Or I'll go into a history class and we talk about the evolution of eating and the evolution of how we get our food, and how we break down that food afterwards versus our calories. And I also helped that school build a garden, because we realized that, as Heather brought up earlier to Ms. Jackson, that obesity is the effect of 1,000 paper cuts, which is a quote by Andrew Rundle, meaning that there's not just one silver bullet to it. We can put the pushcarts out there and they're going to make a huge impact. But you have to teach them multiple ways. You have to be able to give them the access, and then you have to teach them, which is where this community comes involved. And at our garden, we teach the kids how to grow the food, and then we actually teach them how to sell it so that they can put money in their banks for college. So, multi-problem.
Thank you. And so
what seems to be illustrating is we need both education and changing in the environment, and it's the integration of the two that makes it possible for all of us to eat healthfully.